This is the Komen Utah Grant Review Workshop for the 2017-2018 grant cycle. I have split the recordings into two separate sections so that you can go to the areas that you need more information on a little bit more easily. So this first video will be about the overall process, a little bit of the history of who we are as an organization, things along those lines, and then the separate one will be how to navigate GEMS, which is our online grant management system. So this one should be a fairly quick overview. Just a little bit about who Susan G. Komen is. Our vision is a world without breast cancer, and our promise to save lives by meeting the most critical needs in our communities, which is what we do through our grant program and investing in breakthrough research to prevent and cure breast cancer. Here in Utah, we are a relatively small staff. There are 4 listed here. We actually are bringing on a new development person at the beginning of the year. We have a very strong board of directors, hundreds of volunteers and interns that help us do what we do. And what we do is we raise money to support grant programs, and we serve the entire state of Utah. We support research, raise awareness, provide education, participate in advocacy initiatives, and then we, as I mentioned, grant funding to local breast cancer programs. Our impact in Utah since 1997, we have invested over $8 million in both research and community grants. $6 million of that is to our local grants program, and which is what you will be reviewing grants for, and then that $2 million that has gone to our headquarters, who coordinates all of our research grants. And we're always proud to mention that $2 million, actually over $2 million, has come back to Utah for research at projects at the Huntsman Cancer Institute. We are active in a statewide coalition, the Utah Cancer Action Network, as well as the Mammography Action Coalition, or excuse me, Committee. And we have been becoming more active in policy issues locally here in Utah with the Health Policy Project and their Medicaid expansion advocacy. Research funding at the national level, as well as oral parity and the National Breast and Cervical Cancer Early Detection Program, which is the free screening program that is a federally funded program that is administered by the state health department here in Utah. So a quick overview of the community grants process. As I mentioned, we split our funding into 2 categories. 75% of what we raise stays here to go into community grants, and then the other 25% goes to research. And we model our request for applications to fill gaps and holes in what we call our breast cancer continuum of care. So you'll see that education is a circle around the outside, because education and awareness is important in every aspect of the continuum. But typically that education starts and brings people into the continuum through screening. That's what we hope. That's the best case scenario, is that they come in for a screen as opposed to coming in after having found some sort of symptom. The screening is normal. They go into follow-up and survivorship. Go into follow-up if they aren't diagnosed. If there's an abnormal screen, they will go into a diagnosis. If no cancer is detected, then they go back in straight across over into follow-up. If they do receive a breast cancer diagnosis, then they go into treatment, and after treatment is completed, again, follow-up and survivorship, and then start the process over again, with their follow-up screens, things along those lines. This is just a little model that talks about what we do to develop our community grants program. So at the very top, we learn from our community profile and our mission action plan that we develop, and I'll talk a little bit more about that in another slide. We develop and issue the RFA, and we hold a grant writing workshop for all the applicants. We conduct a compliance review for all of the applications that come in. Review the applications, which is where you all come in. The board approves it, and then we award the grants, monitor and manage the process, and then we evaluate the impact, and then we start over again. Quickly, a little bit of information about our community profile. Every 4 years, our headquarters requires each affiliate across the country, and there's about 100 affiliates across the country in the U.S., that what we do is a needs assessment of breast cancer health services in the state of Utah. So we published ours in, I believe it ended up being published in the summer of 2015. We developed a mission action plan from that. And the purpose of it is to identify gaps in services or delays or issues specific to breast cancer services. And that's how we target our grant funding and where our priorities come from. We did a collection of data. We had a quantitative section that looked at breast cancer mortality rates as well as late-stage diagnosis. We looked at demographic information and developed a plan of action and how close these areas were to meet the Healthy People 2020 initiatives for those two categories, which is, the mortality and late-stage diagnosis. The community profile is linked on our website if you are interested in reading more about where our priorities come from and the process itself. The target communities that came out were Utah, Davis, Iron, San Pete, Sevier, and Wasatch counties. Utah and Iron counties have the lowest screening rates in the state, and the state of Utah actually has one of the lower screening rates in the country. The Intermountain West, for some reason, has some of the lowest screening rates, so that includes Wyoming, Utah, Idaho, Montana, and Nevada. All areas need a better understanding of risk and screening guidelines. There's a lot of confusion about family history, how often to get screened, at what age to start screening. That misconception about those two things is very high in the state of Utah. All areas are projected to miss, all of the areas mentioned above are projected to miss those Healthy People 2020 targets. And Iron County has a very high uninsured rate and a high number living below 250% of the federal poverty level. And that 250% is where the BSEP program, or the National Breast and Cervical Cancer Early Detection Program that I mentioned earlier, they are able to, up to 250% of the poverty level, they're able to get a free screen, and then also they would qualify, if diagnosed, they would qualify for the breast and cervical cancer Medicaid program. All of these areas have lower than average access to primary care providers, which is a statewide issue, but these particular issues, it's even more severe than the statewide average. We don't have a lot of primary care providers, particularly in some of the more rural areas. So it's difficult to get that initial referral or initial conversation to go in for a mammogram. The entire state, again, needs comprehensive survivorship support programs. So a little bit of information quickly about our requests for applications. We have funding categories. We have 4 funding categories for our program. And they are screening and diagnosis, treatment and treatment support, wellness support, and community health workers. These funding priorities are specific to each category, and I'm not going to read these. These are on our website. They are in the RFA that you will get a copy of, and they will be in the online grant management system. But just understand that there are specific funding priorities for each category. Anyone who is a nonprofit organization serving anywhere within the state of Utah is eligible to apply. And the program must be specific to breast health and/or breast cancer and address the priorities in the previous slide. The organization is, assuming the organization is in good standing, if they are a prior grantee recipient, and free of conviction of fraud or crime involving financial, administrative impropriety. So we actually do a compliance check with everything that comes in. So when you receive your applications to review, they will have met this eligibility requirement. Very quickly, the application overview, we have received 13 applications from 12 organizations totaling $487,000. And you can see how it's split out by category. The screening and diagnosis, 5 applications for $231,000. Treatment and treatment support, 4 applications at $114K. Wellness support, we received 2 applications for $49,000, and community health workers 2 applications for a total of $92,000. So a little bit of information here. What I am going to do, because we have so few applications in those 2 categories at the bottom, I am combining categories for review. So the screening and diagnosis and the community health workers will be combined. So if you are assigned to those categories, you will review 7 applications. And then I will combine treatment and treatment support with wellness support. So if you are assigned to those categories, you will be reviewing 6 applications. The review process. So in the system, you're going to have a review panel that comes up in the system, and they will be split up in these categories. So, and you'll see that there's a percent weight attached to the scores in each of these categories. So you'll notice that impact and project design have the highest percentage. So those scores in those categories will be more highly rated or weighted within the scoring algorithm. Statement of need, organization capacity, monitoring and evaluation, and then the overall goal and vision of the program. Those are the categories that you will be reviewing in. In the system itself, there will be questions that prompt thought and discussion about how well that application meets the criteria here. So that will be available to you. I will also send that to you. It will be attached to the email that this recording was linked in. And we'll give you more information about things to consider when you're looking at the application. There will be also information about the scoring anchors, which every category or criteria within the application will be scored on a ranking of 1 to 7. And you can read here what that number corresponds to as far as how it's viewed. Those will also be, again, linked within the system as well. The review process, so as I mentioned, there is a compliance review that is done by affiliate staff, and assuming they have met their compliance, then they will be passed on. We would not pass on an application that does not meet the compliance review. So a minimum of 3 panel members will score each application separately. It takes on average between an hour to 2 hours for each application. Once you, I've heard that the first one is usually the hardest, and then you start reading through some of the other ones, and oftentimes people will go back and change the scoring on the first couple that they do once they kind of get a sense. So some reviewers have said that it's easier to kind of read through them all and then start trying to score them, so that you kind of get a sense of where everything falls in line, because people tend to either score much more harshly on the first one or much more lenient, depending then on who follows. So just want to give you a little piece of advice there. All review and scoring needs to be completed by Tuesday, February the 7th, 2017 at 5 p.m. We will then, we will start setting up the ranking meetings prior to that time frame, but we will schedule them between February 8th and February 17th. just a couple of little things to keep in mind. Applicants understand this as well, that funding is never guaranteed from year to year. So just because an organization has been funded for the last 5 or 6 years, there is no guarantee. They understand that it's a year-to-year contract. So our goal is to fund the most impactful programs, not necessarily the most programs. So we want to make sure that we are scoring and ranking the most impactful programs the highest, because we never seem to have enough money to fund all of the requests that come in. So we received, like I mentioned before, $487,000, I believe, is the total amount. Last year we were able to grant $364,000. So just to kind of give you a sense. And one of the things we always like to ask reviewers when you're scoring these is to keep in mind, would you donate your own money to this program? In looking through it, does it speak to you? Does it say, you know what, this is something I would be willing to invest in? That sometimes helps kind of frame the thoughts around those applications. One other reminder that I'm going to put here, because I am going to talk about it in the GEMS recording as well, but I want to make sure that I don't think I can say this enough. You do need to report any conflicts of interest, any confidentiality, or any information that is in these applications needs to remain confidential. The discussions that we have in the review panel sometimes can be a little critical sometimes of some of the programs and objectives and things along those lines. We want to make sure that we're protecting these organizations who are doing such amazing things in the community. So I will just put that little reminder into this. There is a link in here. I don't think it will work on the recording, but you can take a look at that talks about the conflict of interest, as well as the code of ethics for reviewing for us. And with that, I believe that's the end of this particular section. Yes, it is. So join me in the next recording, and we'll go through how to navigate the GEM system. Thank you.